So in the United Kingdom, if you're a pharmacist working in general practice, you form part of a multidisciplinary team in a consultation room exactly like a doctor and a nurse, in a non-dispensing role, using your clinical expertise in medicines to assess people around management of their specific long-term conditions, but also assessing people on multiple medicines to ensure they get the best use out of their medicines on a day-to-day basis, but also focusing on improving public health and social care needs of individuals, but supporting integration of general practice with the wider healthcare system, such as community and hospital pharmacy colleagues. So in the United Kingdom, we've recently had the evaluation from University of Nottingham. It's an external evaluation on the impacts of pharmacists working as part of a general practice team, and they have shown some really positive results. They have showcased that pharmacists, particularly prescribing pharmacists in a collaborative environment, are able to work autonomously and are well accepted by their healthcare professionals. But also what is also able to show that pharmacists have been educating the healthcare professionals around improving the whole team's ability to help with medicines, increasing access to appointments, improving adherence to medicines, particularly in those people with long-term conditions, helping people who are on complex polypharmacy, those who are taking lots of medicines as well, reducing medicine errors and improving medicine monitoring on a day-to-day basis. From a personal perspective, I think I went to university as an undergraduate for 5 years at the same level of a doctor to be an expert in medicines. This enables the pharmacist to utilize their clinical skills as part of a collaborative multidisciplinary healthcare team to really make a difference to patient care. And I'm sure, as all healthcare professionals have wanted to, is to deliver the best form of care we can to the public. So there are two main models essentially within England in particular of how pharmacists in general practice will be funded. The first model is that many pharmacists who have been working in general practice have been working there for 5, 10 years even, and those GPs have decided to employ the pharmacists directly with their own finances. The second one is the large NHS England programme, which the NHS provides a contribution towards the salary and recruitment costs of pharmacists, and the GP practice will top up the funding to help employ the pharmacist as well. Well, it's really important that pharmacists who work with general practice work with their wider healthcare system pharmacy colleagues. In the United Kingdom, it has been showcased by the University of Nottingham report that pharmacists working in general practice work really well and promote network collaboration with community and hospital pharmacy teams. In particular, if we focus on how I work in my general practice with the community pharmacies on a number of different important aspects. Better communication between both sets of teams, ensuring that all medicine-related queries are resolved for patients. We are working with them on a day-in-day basis to ensure there's seamless transfer of care, particularly when a patient has been discharged from hospital back into the community setting. But also we bring community pharmacy into the GP practice to talk about educational pieces, to do case-based discussion, and develop better team working relationships. When we're working with hospital pharmacy in particular, it's very similar in that nature, focusing on the transfer of care and medicines reconciliation pathway when patients are being discharged back out in the community to ensure there's no medicine-related errors associated with that, but also using the clinical expertise and the specialist pharmacists working in those hospital settings to help us manage our patients better within a primary care setting.